Welcome again, everybody. Thank you so much for coming to this live webinar event, a meeting of minds, which, as it says, is a conversation about mental health. We are very, very lucky to have some absolute experts speaking, both staff members and also one of our alumni. I am Rachel Sunbury-Thomas. As it says, I am the registrar at the university, which doesn't actually mean I take the register, much I think most of my friends think that is a truth. But actually, on a very, very broad level, it means I head up the professional services side of the university. You are part of an alumni community now, which is 275,000 strong, of which we are very, very proud and very, very keen to keep in touch with you and to encourage you to be part of this network, hence this series of webinars as part of that effort. I would now like to welcome our speakers, and we're very grateful that they are giving their time to share both their knowledge and expertise with us today. I should explain that there will be time for audience questions at the end. Please feel free to use the Q&A function if you want to put questions to our speakers, and the chat function if you want to put more general comments. So I am now going to shut up and hand over to the panelists. If you could quickly introduce yourselves before we hear from each of them in turn. So Swaran, you're just below me on my screen. So could you kick off, please? Thank you.
So do you want me to just introduce myself?
Just a quick introduction, yeah, please. Don't worry, I'm going to come to you and ask you to speak.
So good afternoon, everyone, and thank you for inviting me, Rachel and team. My name is Swaran Singh. I'm a professor of psychiatry at Warwick Medical School and a consultant within the NHS.
Great. Afiniki?
Hello, I'm Afiniki Akanet. I'm a GP with a special interest in mental health.
Great, thank you. And last but not least, Andrew.
My name is Andrew Oswald. Once upon a time, I was a fairly conventional economist, but I'm afraid those days are long gone. And I suppose I'm known more these days for working on the determinants of human happiness and mental health. Officially, my title at Warwick is a professor of economics and behavioral science, and I've done about 30 years in the university.
Great. I think I'm going to refer to you as a professor of happiness from now on. Right, thank you. Swaran, would you mind kicking us off, please?
Right, thank you very much. Most of you will have heard the phrase 1 in 4 is mentally ill. And there's a comic retort to that, which is think of 3 of your friends. If they are not mentally ill, it must be you. Now that's the statement, the funny line hides a profound truth, which is that when we think of mental illness, we think of people other than us, not us and our friends. And that is true. When people think of mental illness, they think of a particular kind of abnormal behavior or abnormal being. If you replace the term mental illness from, say, pain, and I say 1 in 4 people in the world or in the audience right now has an ache or a pain somewhere. It's a trite observation, probably true. So that's our problem. We use the term mental illness and increasingly mental health, as if by saying mental health, we will change something. We use it for a range of problems, from everyday misery to severe dementia. So it's not one condition. It's a whole range of disorders with different causes, different presentations. Not all of them difficult to treat, but some very difficult to treat, some chronic, some acute, some severe, some not so severe, some episodic. So I hope we won't have time to, but I hope when we are talking about mental health and illness, we are careful in where we use our words. The other important thing for this purpose is that mental well-being and mental illness are not on a continuum. Less of one doesn't make more of another. And that's one of our problems when we come to talking about prevention in mental health. What is the 5-day of mental illness? There isn't a simple thing like that, because there is a simple thing for pain, for instance. So if you think of mental illness broadly as suffering, the suffering is universal. And when that suffering becomes a serious illness, is the real skill of being a psychiatrist, being a doctor, and trying to help people. My expertise is in youth mental health. I set up something called early intervention in psychosis, psychotic disorders like schizophrenia. Now, these are very serious. But here, paradoxically, we know how to treat them. They're quite easy, not easy to treat, but we know how to treat them. And we've shown that if you intervene early, you can make a lot of difference. You can transform the trajectories of people's lives. Early intervention has been called the most positive development in mental health reform for the last 30 years or so. The other thing we've learned in the last 2 decades is that youth, 16 to 20, 25, is the period of maximum psychological vulnerability. So when we are winning Wimbledon championships, when we are at the peak of our physical prowess, we are our most vulnerable psychologically. Most serious mental disorders begin before the age of, around the age of 16, some before, 50% before, but 75% before the age of 25. I get asked a lot, is mental health worsening in young people? And again, the problem is you have to say what mental health. So if you ask a question like that, I could say yes, no, maybe. They're all three correct. Mental health problems of the kind schizophrenia, psychosis, bipolar disorder, they are not worsening in incidence or prevalence. There is some increase because of cannabis use, but by and large, these are, because they are biologically driven, their incidence has stayed relatively uniform. What we have seen, the yes answer to that question, are things worsening, is in emotional disorders like anxiety and depression, particularly among young people. I think there is some evidence that these have really worsened in the West. In England, for instance, eating disorders, anxiety and depression in young women have really shot up, especially after the pandemic. And here, it's trickier to say, when does misery become a malady? When is it unhappiness, and when is it melancholia? Because unless we can do that, we can't decide where to focus our attention. This group, though it's major risk of mental health problems, is also going through a normal period of turmoil and angst. The teenage angst is a real thing as people struggle to find their identity. And today, in the age of social media, there's a very interesting social experiment going on in the world. Young people are subject to influences that humanity hasn't seen before. We say things are unprecedented. This is genuinely unprecedented. Like the pandemic was genuinely unprecedented for our generation. We really don't know where this is heading. I'm not being a Luddite. I'm not saying internet is a bad thing, but we are exposing our young people to influences that humanity hasn't been before. So I think this is a time to pay attention to the health of young people. It's time to be very clear who needs help, how to get to them quickly, and to put in place scaffolding around young people to build their resilience. Every culture has traditions and customs and rituals to help people transition from childhood to adulthood. We've removed those. We've removed all that scaffolding from young people and left them to their own devices, literally to their own devices. And I think it's a very interesting time for people, some of us say, working at the university with that population, some of us working clinically, GPs, primary care people, to think carefully about how do we find those who need help, and how do we get help to them as early as possible. So I think I'll stop there, Rachel, if that's okay. You're on mute, Rachel.
I know. You would think by now, how many years does it need to be until I get to master that mute button? Lovely. Thank you very much indeed, Swaran. Andrew, can I ask you to address us now, please?
Yes. I'm not a psychiatrist, as I hope I made clear. You might want to think of me on this kind of general topic as a sort of statistician, looking at the patterns that we see in the world, and especially today, perhaps in the UK, and trying to understand those patterns. In this session, I thought I would try to explain that there's a great deal of evidence, growing evidence, that the midlife crisis is a real phenomenon. And I thought I'd begin with the bad news and then go on to the better news. The term midlife crisis came from a man called Jakes, an iconoclastic thinker, Elliot Jakes. I never met him, who wrote an article in the 1960s called Death and the Midlife Crisis. In it, he was kind of psychoanalyst, among other things. In it, he recounted stories of patients that he'd met and people from history. And he argued that people have a kind of crisis of feeling when they get to their late 30s, midlife, in the time that he was thinking of that. In modern data, we're getting more and more data to suggest that generalized anxiety disorder, sleeping problems, migraine, extreme job stress, suicidal feelings, all have a tendency to peak around the late 40s. So if you're in that band, or you're approaching it, I'm pleased to say that, or at least somewhat pleased to say that that's behind me. You may wish to know that this isn't entirely normal. There are some very striking statistics there. If we look at actual suicides in this country, sadly, the suicide risk per person is double in the late 40s. In your late 40s, double the risk of those, say, in their early 20s or those in their mid 70s. Many of our citizens don't realize that. They don't realize that the peak crisis time in, I'm afraid, in actual taking one's life is just before 50. You can look up the Office for National Statistics data if you would like that. There are all sorts of other remarkable facts. About 50,000 people a year get taken to hospital for sleep disorders in this country. 50,000 people go into hospital for sleep disorders. I'm afraid I don't know clinically how bad you have to be in that category, but the NHS provides many interesting graphs on its website where you can see that the striking hill shape, as with suicide, I'm afraid, a striking hill shape in the numbers of people going into hospital for sleep disorders with a striking peak in the end of the 40s. If you remember your Macbeth, I had to learn it at school. Of course, Shakespeare was very well aware that sleep disturbance was a marker of mental distress. Now, part of me as an economist, my original PhD was in economics, and this is particularly paradoxical for economists. Why? Because what we used to call blue-collar workers reach their peak earnings in their late 40s or about 50. White-collar workers tend to reach peak earnings through their life in their early 50s. So these people who are exhibiting a lot of distress, and we don't understand why, are extremely well off. Moreover, in our kinds of countries, we're fortunate because by and large, in your late 40s, ill health has not struck. The background tapestry behind all of this, of course, is that, objectively speaking, we live in the safest and the most prosperous countries in human history. And researchers like me do not understand that pattern. So why might there be evidence for this crisis of midlife, and why does it go away? Well, one original theory due to Jakes was that, if you think of a golfing analogy, if you ever play golf, you know you play 18 holes, and the notion is that when you get to the 9th hole and you look on the back nine, as golfers call it, you realize that you're going to end up in the clubhouse from which you will never emerge again. Jakes thought that humans were aware of what their likely halfway point was, and then on the second half of life, they were, as it were, brutally faced with that and had to come to terms with it psychologically. That's a very hard theory to test, although I could say a little bit more about the statistics on that. A popular theory among happiness researchers, and I'm partly that, because in our kind of country, the reported happiness follows a U shape through life, exactly mirroring the hill shape in mental distress. And a common theory was that the low in midlife was because of what you might call dashed aspirations. I wanted to be the Vice Chancellor of Warwick University, and I didn't make it. I wanted to captain the England football team, beating Germany at Wembley, and I didn't make it, and so on. And that notion of most people can't reach as high as they want in life, that does seem to have a ring of intuitive truth. However, a few years ago, some primatologists and I had a paper in one of the American science journals where we took data on great apes, on chimpanzees and orangutans, and we found that their mental well-being also seemed to follow a U-shape through life. Roughly speaking, they live half as long as humans, so it was all scaled in that case to another symmetric U-shape. We don't know what might explain that, but it's feasible then that something physiological or even hormonal is going on. So what about the good news? That's the bad news. I like, if I'm giving public lectures, to remind people that the good side of this is if you are 48 or 49, then the key thing is just wait. If you just wait, things will improve. And that's a very important fact, I think, to try to explain to any of your friends in that age group who are really suffering. I can't tell you exactly why there's this tremendous psychological recovery that's traced out in the data, but that is one of the good bits of news, I think. Beyond that, you can do things to try to counteract the midlife low. We now know that the things often recommended by cancer specialists and heart disease specialists are effective at helping mental well-being. Some of the work I've had a hand in finds that mental well-being increases up to about 8 portions of fruit and veg a day, up to about 8 portions. And there's growing interest in the so-called gut biome, even though we don't know why, but it does seem to be true in the latest research. There are profound linkages between the things we eat and what happens to our emotions, what happens in our brain. A very distinguished, formerly Oxford researcher, the late Professor Michael Argyll, said that he recommended Scottish country dancing. And I'm not wild on Scottish country dancing, but it had 3 elements that I think are worth bearing in mind. And he said that combines exercise and friendship and music. And those elements do seem to be powerful. So when I'm asked, perhaps at the end of a public lecture, Professor Oswald, how do I avoid the midlife low? The first thing I say is, well, you don't seem to be able to if you're a typical person, but what you can do is things like invest in friendship networks. They often get neglected through the 30s and the 40s as people strive to move up some job hierarchy. I suspect I was bad at that, if that would be the word, when I was trying to work my way up at Warwick. But friendship networks are worth cultivating in your late 40s as a kind of defensive mechanism. Cut your commuting time. That also comes out of the equations if you possibly can. There's a current of thought among well-being researchers that people overinvest in commuting relative to their own happiness because they think that being promoted and getting more money will win the day, and they may underestimate the psychological damage done by commuting. But the key thing, it seems to me, and I'll stop there if I may, is just wait, because the happiness curves go shooting up. And delighted to say the happiest people on average in our country are age 73, and I'm looking forward to it, ladies and gentlemen.
You and me both. Thank you very much. That was absolutely fascinating. Afiniki, can I hand over to you now, please? Thank you.
Yes, thank you, Andrew. I found that quite interesting, especially because I'm going to be 40 next year. And I keep wondering whether the 70s happiness is to do with the fact that you don't have any small children in the house anymore. But yeah, I was asked to bring things together, and as a GP, we're quite good at doing that kind of thing, because GP, for those that don't live in England, stands for general practice. In other countries, we're called family doctors. And I came to the UK at the age of 16 with a dream of becoming a medical doctor. So it was quite interesting to hear the statistics as well about how 16 to 24 is quite a peak time for mental health. I'm really happy that we're talking about this. And I think mental health awareness, because GP is connected to public health. In fact, in the old days, it used to be one specialty. I quite like giving these talks because I feel like it's an opportunity to raise awareness about these things so that we can think about it and think about ways to prevent mental illness. Because the fact that we're talking about our mental health doesn't mean there's something wrong. If I talked about checking my blood pressure or checking my weight or doing my blood test, you wouldn't think I was ill. I'm just checking things to do with my physical health. But that's the same thing with mental health. We need to look after our mental health so we don't end up with mental illness. And just because we've experienced mental illness doesn't mean that mental illness is permanent or that we can't live a good life. We can get help and we can learn to manage things. But talking about it like this really just helps us to prevent problems and also to find ways to help each other. So I think really knowledge is power. That's the main reason why I support things like this, so we can know more about it, understand it, and be able to handle things better. So when I came to this country at the age of 16, mental health topics were not a big thing, especially not in Africa, where I came from. I was born in Nigeria. I came at that time to study, and the focus was I want to become a medical doctor, not thinking about all the other aspects. I'm very grateful for my parents that supported my dream, because it was me that wanted to come and be a doctor in the Western world. But then we know now that things like loneliness, migration, racism, the just being away from your normal environment can increase your risk of developing mental health problems. And I'm so grateful that I did have lots of protective factors as well, which I will talk about more later on. But I think reflecting now on those days, I realized that that's part of why mental health is one of my special interest, because I'm quite keen to help people to be aware of these things so we don't end up in difficult situations. So talking about protective factors, I think one big one for me was having a faith, having hope. I'm a Christian, so I believe in Jesus. Having hope, how Andrew said we should just wait. Sometimes that waiting positively and hoping that things will get better, that helps as well. Having a focus and a determination. When we're younger, we have things that we want to achieve. And it's interesting that Andrew's talking about the midlife crisis, when people look back and think, well, I haven't achieved what I wanted to achieve. But yes, something else that helps our mental health is to have new dreams. You're never too old to dream. You're never too old to learn new things or to have new hopes and look forward to new things. I was joking about grandchildren earlier, but yes, if the house is getting quiet and people are thinking, I miss those good old days when the kids were at home and the house was full, you can have new things to look forward to, the grandchildren or visiting other people, building those friendships. And it doesn't have to be your own things. You can be happy for others, get involved in other people's lives, which is why I'm very big on volunteering as well. So I started a charity which keeps me very busy as well. But I think getting involved with your local community with charity work, that helps our mental health as well. As doctors, sometimes we can be very focused on physical things and things that we can see. But with mental health, there's a lot that cannot be seen but really matters, which is why they say there's no health without mental health. So it's really important to listen to these simple things that might sound like common sense or soft talk. I remember when I was in medical school, it was quite a big joke about things like health in the community and the softer topics that were not very intense, being things that nobody really wants to learn. But I enjoyed those, because even though they seemed like common sense and they seemed like easy things that everybody should know, there are a lot of people that don't really think about these things, and then we end up suffering the consequences of not paying attention to them. We've already talked about building friendships as well, investing in that time. If there's any good thing that came out of COVID pandemic, it's the fact that we can now do a lot of things remotely. So we can afford to take more control of our time, so that we can choose the things that we spend time doing. So even if it's the 1 hour commute that we're cutting out of our days, we should be a bit more intentional with what we're doing with that time, not just letting it get sucked in again by other things and then being stressed all the time. If any of you have looked at my website, happiness over stress is my thing. It's really important to be reflecting regularly to make sure that we're happy now, not just later, not when I'm 50, when I'm 70, I'll be happy. You can be happy now. You can be intentional about it. I was asked to talk about how the cost of living crisis is also affecting mental health, because I wrote a book called Money and Mental Wellbeing during the pandemic. And that's because as a GP, we did see a lot of we did have a lot of mental health consultations, because just people were really affected financially in the pandemic. A lot of people were furloughed, a lot of people lost their jobs. People that were in certain professions that were not key worker roles felt really vulnerable because their source of income that they've always had all their lives was suddenly not as secure anymore. So you can imagine the mental health impact of that, being in your house and not knowing whether you can still afford it next year. So all those things are connected. And sometimes we keep it in two separate boxes, thinking that money is a different issue to mental health, but it is very much connected. And I couldn't find any books that were connecting these two important topics. Yes, we're talking a lot about mental health. Yes, you'll find books talking about money and how to manage money, but putting those two things together can save us a lot of stress, a lot of pain, and a lot of heartache in future. And we found that people that understood this and realized that their decisions today in terms of how they make and manage money and how it influences their mental health are actually doing better as they get older. So when we're younger, in our 20s, in our 30s, we're choosing our professions, we're choosing what we want to do with our time, we're choosing whether we want to go to uni, whether we want to buy a house, and all those things, all those decisions affect the kind of financial commitments we're making. It affects how much debt we get into if we have to take debt to do those things. And people don't realize that all that can have an impact on our mental health. And I think talking about these things opens the floor to get people to start thinking, these choices I'm making today, how is that going to impact on my mental health and my well-being? Connecting those dots is so very important. It also helps us as well to be able to empathize with people who are struggling, because yes, some of us might not have had the information, some of us might not have had the stepping stones that other people might have had. We've been talking about how this country, England, where I'm based, is one of the richest countries in the world, and people do have safety nets, social services, pensions to fall back on. But there are people who are struggling in spite of all the good plans they have made, in spite of all their hard work. You know, I always think about the hardworking people you find in some countries hawking morning to night every day. If being rich, being comfortable was all about hard work, there would be no poor person in certain countries, because people work hard. It's not all about working hard, but sometimes we forget all the extra privileges that we had that get us to where we are. So even if we're not struggling with our mental health, we should, you know, understand these things so we can be able to empathize more with other people who might be struggling either because of choices they made or situations they found themselves in. You know, there are people that have been through trauma and all sorts of things through their childhood that have made them who they are today, and it means that they're still struggling with their mental health and certain aspects of their finances because of it. And I'm just really passionate about people understanding that those choices we're making, so even me looking after my mental health now is not just for me, it's also for the sake of my children. So as part of my special interests as a GP, I work as an eating disorders GP in Warwickshire, and a lot of the children I'm seeing are children even from well-to-do families. And you'd be surprised that sometimes even the parents don't even have time to support their children to get the treatments that they need to get over those eating disorders, because they've committed themselves so much financially, either because of private schools or because of massive houses or because of investments that they can't really afford, that is now then having an impact on their own mental health, and then in turn having an impact on their children's mental health and affecting their ability to be able to support their children through these mental health problems. Protective factors that I talked about, having the simple things of life, a happy family life, a peaceful home, you know, those things don't cost any money, and those things we can be intentional about. We can try and build those in our younger years. You know, it's never too late, even if you're in your 70s now. You know, I'm not sure how old people are that are listening. You know, even if you're in your 70s now, you can make changes, you can apologize, you can build relationships, you can go back and build bridges that were broken, because those things don't cost any money, but they do help our mental health. I was talking in some other place recently, and they talked about evidence that having a faith, having hope does help with your mental health as well. Those things don't cost any money. Having resilience, these are things we can teach our children. These are things we can build ourselves. It's not something you're born with. Having goals, having things to focus on, reflecting often, all those things are protective factors that can help our mental health. This is typical of me. I often start talking and then I end up talking about 100 different things, but I hope that something I've said has been useful for you today. And hopefully through the questions, we'll get to some other topics. But thank you for having me.
Thank you so much, Afiniki. And we've got lots and lots of brilliant questions coming in. So no danger of stopping anytime soon. So, and I also have a couple that were submitted before the event. So I'm going to probably kick off with them, but actually some of them have linkages with the ones that are coming in. So my first one, Swaran, can I ask you to address this one? It's about, it's really interesting actually, because it's about the individual versus the collective. So one of the questions that came in beforehand was whether or not our current education system is nurturing the individual over the collective in terms of achievement, and thereby, you know, kind of removing that sense of we're all in it together. Whereas there's also a question in the chat from Simon, who is 73 and a very, very happy man, about looking at kind of younger people nowadays who seem to have lost that kind of, you know, that kind of radical individual rebel persona, but being much more influenced by their peer group. So is there anything you can tell us about this kind of individual collective kind of dichotomy? If it's
well, these are both very interesting questions, but within them is a multitude, and it's I will try and do justice, because we could speak the rest of the session just on this. So the first bit of the question, if I slightly rephrase it, I don't think it's fair to pick out the education system as being flawed. It's where we are as a society. So the question rephrased is between independence and interdependence, which is better for our mental health? And if you put it like that, all of Western psychology has been about independence and separation. I left India because I wanted to get away from the interdependent thing. I wanted to come to the land of narcissism, where you could meet your own needs. And now that I'm older and I have children, I see that my children will never know what it is to grow up in a joint family. So now, one is not better than the other. These are the choices we make as a society. Aristotle said, the values of what society values becomes the value of that society. We value independence a bit too much now. And I think we have lost a sense of interdependence. Our identities are increasingly atomistic, cellular. In other cultures, identities are network. You are somebody's son, somebody's daughter, somebody's husband. You are defined by a set of rules and responsibilities, rather than here, increasingly, we see people defining themselves by narrower and narrower categories, skin color, gender. And that's a social shift. And that was predicted in the 60s and 70s by wise people who could see ahead. And the social media is the apotheosis of that. It's the ultimate tool of narcissism. So I think there is the balance between independence and interdependence. And I think the independence has led to the loneliness and isolation and fragmentation and alienation that we are seeing. That's one part of the equation. Interdependence has also had its problems, especially for young people, because part of being young, and that's the second question from Simon, part of being young is to break away from being a child, dependent on your parents, to being independent and striking your own identity and being rebellious. I don't think young people have stopped being rebellious. And I don't think it's fair to say that they are uniquely under peer pressure now. Young people have always been influenced by peer pressure. We are influenced much more by our parents before the age of 10, but we hit puberty and then our peers become our real influence. And that's true all over the world, all cultures. So that I don't think that is new, nor is the fact that young people are rebellious, that is new. I think what it is young people are now left alone with nothing but a peer pressure, which is really mostly hostile mirror, distorting mirror that the peers hold to view through social media. And I think that is the new bit, not the rebelliousness, not the need for independence, but this distortion of reality produced by social media.
Yeah, so
that answers it.
It does. It was a brilliant answer to it. Interestingly, there was also a question in the chat about social media and whether or not it can be a force for good as well as a force for ill. Am I right in gleaning from what you said that you think it is more a force for ill than for good?
No, I wouldn't say that. I don't know how to measure it. I don't know whether it's 51 and 49 or 60 or 40. There's no way of measuring it. It's a tool. It's a tool like a knife is a tool. A surgeon can use a knife to heal something. You can use a knife to kill someone. It's a tool. It's I think it's a tool. It's a new tool. We don't know what to do about its potential harms. Our systems of lawmaking, our systems of social change are far too clumsy and not agile enough to keep up with the change. But it's not a national problem. It's a big social change. I think it'll take 100 years to look back at what happened. We are right in it. So it's difficult to tell. But I don't think there's a way of saying it's good or bad. It's been a huge succor for people who are lonely, people who are socially anxious, people who can't go out. But it's also brought all kinds of people together. And I think my worry is it distorts reality. Reality is messy. Social media allows, or virtual reality allows you to create a very different, neat persona, which doesn't have to entangle itself with the messy reality of the world. So it distorts what it is to be real.
Yeah, great. Thank you very much. Now, Andrew, I've got a question for you. It's kind of, there's varieties of this on the chat, but basically it's asking, is there a kind of any evidence of a kind of a breakdown of sex and gender and marital status in midlife, those who suffer from midlife crisis? And kind of one thought also in the chat is about, is there a connection between potentially the menopause with females and midlife crisis hitting?
Yes, it's a very natural thing to think about. And in the early days, my colleagues and I expected to find marked differences in what you might call the life cycle of mental well-being between men and women. But now we no longer think that. At the most extreme, you could go back to the rather sad suicide data. You find there's a hill shape for men peaking in the late 40s, and there's a hill shape for women peaking in the late 40s. Of course, women take their own lives much less often than men, but the broad shape is the same. And the now perhaps quite well-known U shape in happiness through life in all sorts of countries and data sets, that seems to have a remarkably similar shape for males and females. So I can't explain why menopause doesn't produce a different kind of regularity in the data. It's just my job to report that there's a lot of symmetry between males and females.
About that again. Yeah, it's interesting because it would be your kind of, it would be the assumption, but as you say, it doesn't seem to be backed up. Right, Afiniki, can I ask you one that was submitted earlier, which is, I think, is a really interesting question. It's about if trying to change yourself to improve your mental health can be considered non-authentic, is that in turn bad for your mental health? Fascinating question, isn't it?
That's a good question, actually. I think it's because we're in this generation where people keep talking about be yourself, and then you're suddenly being told, you know, you can change, you can improve. And I can see where it would then sound like, well, that's not going to be good for your mental health if you're changing. But I'm a big advocate for self-improvement. And if changing to be a better version of yourself is what's needed, I think that's going to be good for your mental health. Yes, there will be a brief period of stress and discomfort coming out of your comfort zone because you're not being your normal self, because you're trying to be something else. But I don't know why, for some reason, we've built this image of you need to be happy every day, everything needs to be rosy, that's a good life. The things that are really good and worth having, they're never easy to get. And sometimes it's going through that change, going through that discomfort, that's going to get you that better mental health. Just an example, if I'm somebody that likes spending money all the time, I like going to the shops, that's my fun thing to do. Even if it goes into overdraft, I just keep wasting money even if I don't have it. That's me living my best life. I buy things even if I can't afford it because that's what I feel like doing. But if that's not good for me longer term, it's not good for my mental health, it's not good for my finances, it's not good for my life, I need to change. And for me to change, it's going to involve some very painful controlling myself, some very painful looking for new, better habits to replace the bad habits. It's going to involve some talking to people that know what they're doing, reading some books to change my mindset. And that's not comfortable. That might be not authentic. That might not be the normal me that everybody knows as Nikki, but that's something that I need to do to help myself in the longer term. And I feel even though at the time it might be painful, it might not be comfortable, that is good for your mental health. And it could be related to even things like physical health. If you're somebody that doesn't like exercising and now you're trying to change to be someone that exercises more, or somebody that changes to be more social. Yes, it's interesting because I've recently been doing something to do with Myers-Briggs personality types, and they do stress that there's no wrong or right personality, but we can all learn something from the different types of personalities. So when you understand yourself, you know this is me and this is what comes more naturally to me, and you realize, but for what I need to achieve and for what I want out of my life, this isn't really going to help me, then I need to make a change. I can't keep complaining about it. Unfortunately, I see patients like this that come back to me year in, year out, every month, complaining about the same problems, the same things, and you can see that the change needs to come from them. There's no tablet I can give you that will solve this problem. There's no magic wand I can swing to change this problem, but you need to change. And if we come out of that mindset of, be yourself, do whatever you like, do whatever makes you happy right now, then we're more likely to fight for the good mental health that we want. Social media doesn't help because everybody's, sharing whatever they feel like saying on social media, and it isn't always good advice, but we need to know what's good for us. And if what's good for you longer term is to change, then that's good for your mental health.
Yeah, I think those are very, very wise words, actually taking responsibility for the change in order to improve your mental health. I'm not sure who this one will be for, but it's slightly going back to the kind of the menopause question, but in a different way. So it's just wondering whether the major hormonal changes which happen during puberty is what puts 16 to 25-year-olds most at risk. Is there any evidence of a link there?
Right. Okay. So may I take that?
Yes, please do.
Yeah. Okay. So there's no doubt that the hormonal changes during puberty are profoundly important in our neurological and psychological development. The brain goes through two periods of pruning. One is between birth and 2 years, and the other is around puberty, when the brain cells reorganize their attachment. So here, external influences matter a lot, just like drug use. Mm-hmm. We also know that different parts of the brain grow and mature at different speeds. And this is important. The Platonic idea of Phaedrus riding a chariot. The chariot is pulled by two horses. One is emotion, one is reason. They pull in different directions. The chariot breaks. Phaedrus dies. That has some merit in it, in that the part of the brain that is emotional and driven by desires grows faster than the reasoning containing frontal lobe, the one that exercises judgment and restraint. When I was training, we were told that brain development stops at 18. That's not true. Brain development carries on till the age of 25. And after that, brain is still plastic, but the two are in sync around that age, much more than they are before 25. So among teenagers, the horse of desire is running much faster. It's pulling much faster, much harder. And the restraining horse is weaker, if you call it the rein, if you like. So the impulsivity, the risk-taking, the pressure to rush into things, the bravado, all of that comes from this difference in brain development. So there is quite good evidence. But you must remember, this applies not to individuals, but to groups. Of course, there'll be group variations, there'll be gender variation, but this applies not to individuals. So there is evidence that puberty and the period of development till 25 is quite critical in long-term personality development, long-term resilience, long-term coping. And that's the period when we are most likely to take risks, least likely to listen to our parents who are right there to exercise the restraining bit. But this is not new. This is I have a saying which I put up in my lectures, which says kids nowadays don't listen to the elders and they're misbehaved, and I ask audience, who said this, and they'll say Gandhi or Churchill. Or, it's Socrates. It's 2,500 years ago. So I think part of when we see young people doing things that we think are risky, and we think that the world is going wrong, I suspect we reflect our own decrepitude. I'm decaying. The world is fine. The world is going fine. The young people they will struggle. They'll come out of it. But I veered off. It's human cycle. It's a cycle of human development.
I don't like that word decrepitude. I'm going to ban you from using it again. Thank you very much. Andrew, could I ask you one that's in the chat, which is about, so we kind of know, I think, don't we, that physical exercise is good for well-being, mental well-being and happiness. So it's that kind of slight contradiction that actually, if 73 is the happiest stage, it's also happening when people aren't going to be as physically active as they might have been previously. And how can you explain that?
I can't explain it.
Damn.
Yeah, the U-shape in happiness, of course, it drops off right at the end of life when people do become typically much more seriously ill. We don't understand that U-shape. The statistician and mathematician in me might want to get you to think of there as being two kinds of systems that are going on in determining that U-shape in human happiness. And one is all the socioeconomic and health determinants, all the stuff that we might think matters. Money helps a bit, friendship networks help a lot, all sorts of things, health shocks, of course. And yet there's another mechanism, apparently, which looks almost independent of socioeconomic factors. In my equations, I can see that independence, and I won't try and describe how we can see that. But it's as though there's as I implied, I think that there's a hormonal mechanism or physiological mechanism or something to do with brain science that is operating to take us down and then to take us up. Mm. And that is overlain, you might say. There are overlying forces in our everyday life. Did we get promoted? Did we hurt ourselves? But that mechanism deep down, and perhaps that's why we see it in the great apes as well, we don't know what causes that. At the age of 73, if you're in good health, of course, you can relax. One of my colleagues who works in California thinks that wisdom rises through life, and that's what comes to dominate. Some researchers believe you get to the point where you don't care anymore, and they might phrase it with words that are rather harsher than that perhaps I shouldn't say in a webinar, where they just think life's too short to worry about all the aggravation that I used to worry about when I was 31. That also has some kind of ring of intuitive truth to it, but I'm afraid we do not understand the patterns currently.
So it still remains mysterious, which is a good thing, maybe in some ways. There's a couple of questions, kind of, again, kind of variations on a theme about the influence of parental experiences, as in, your parents and what happened with them. Sometimes can be circumstance, it could be physical illness, or it could be mental illness, kind of there are variations of that in the questions, and whether or not those experiences of parents have an effect on people's mental health going forward, the children's mental health going forward. Swaran, do you want to take that one?
Do you want me to address that? Yeah. The answer is, of course, yes. our upbringing is quite central to who we are. So yes, our parenting matters a lot. I observe that in the West, we increasingly see family only as pathology. So Philip Larkin writes in his poem, "They F you up, your mom and dad." John Cleese has a book saying family, then how to survive them. And we see family only as a toxic influence on our upbringing. And writers who write, nobody is going to get a bestseller out of saying my father was a very loving man. So we pathologize families, and we have forgotten in that the central role of family, which is protection. Most families protect and love their children to the best of their ability. You can see a very hard evidence for that in one single statistic. Outcomes for schizophrenia are better in Chennai, South India, than they are in London. 25-year outcomes. Even though in Chennai, they have extremely limited or no psychiatric care. Now, if you're a cynic, you'd say, well, that means we don't need psychiatrists. Psychiatrists just make things worse. The reason is that mental health services just do a very short bit of getting that young person's life back. The family does everything. They'll find a role for you. They will give you a meaning and purpose in life through the family support structure. Over here, with mental illness, people retreat. Families are forced to retreat because they know when they come to see a psychiatrist or a clinician, they are saying, the clinician is thinking, well, what has the family done to create this? So families have retreated. And the mentally ill in UK paradoxically have lower support than the mentally ill in India. So I would say, of course, parenting matters. Of course, it's absolutely fundamental. But we must remember that most parenting comes from love and care and protection. And I worry about just the whole notion of family as pathology rather than family as protection. I'll let the others add to that.
Yeah, well, actually, I'm going to ask. I'm actually going to move on to another question, but it's kind of tangentially related, I think, because so the couple of questions kind of wanting a bit of kind of quite practical advice, which I think is really good. So one is actually from somebody in their mid-20s whose parent is actually suffering from mental illness. And how do you get them? How do you try and persuade them to actually seek help? It's a very practical question because they don't want to talk about it and they don't want to communicate about it.
It's very hard. It's not just the elderly. It's every age spectrum. One of the tragedies of serious mental illness is that the sufferer will often not realize that they are suffering, especially with psychotic disorders. It's a very difficult problem. Along with the other problem, how do you recognize when somebody is becoming ill in young age?
That was going to be my next question.
Yeah.
Exactly.
So I take the second one first.
Yeah.
You know, when does anxiety become a problem? When does anxiety or depression become a problem? So the criteria we employ clinically are threefold: duration, severity, and dysfunction. If the problem is impairing your function, you need help. If it's very long, it's very severe, that's fine. Most important criterion is it impairing your function? And the best way to get someone to get help is to remind them that they are not functioning at their best ability. Not to say, look, you're causing me pain, or look, I'm worried about you. Say, look, you are not being who you want to be. You're not able to do. And I think that it's a very difficult problem, and it is compounded by the fact, Afiniki, no disrespect to GPs, but GPs will often not be able to advise, or psychiatrists are not able to advise till the person comes. And if the person doesn't come, it's very, very difficult to do something. There are confidentiality issues. There are all kinds of problems. So I start by asking, I do it with my patients, what would you like? So instead of telling people what they want, I say, well, people are concerned about you. You are here. What would you like? What can I do for you? And if I start by, I'm on your side, I'm trying to get you to be your best version, I think that works. It's easier said than done. But that is the only way. Patients, persistence, and constantly reminding the person that they are not being able to do what they want to do. I think that's that. Other than that, I'll have to ask personal question, and this is not the right forum for that.
Yeah, no, absolutely. That is so useful. Now, listen, we've only got 5 minutes to go, so we're going to have to start wrapping up. Whereas there are so many questions that I haven't even been able to get to. So I'm so sorry for those of you that I haven't covered your questions, because they've been absolutely tremendous. But I think the things that I certainly am taking away from this is the importance of being intentional and being, as Afiniki said, being very intentional, and actually, you know, with some of what we've heard on the seminar about the importance of eating properly, all the fresh fruit, physical exercise, cutting down your commute, all that, changing bad habits, actually we can affect our own mental health for the good, and it's nothing to do with being unauthentic. It's being the best version of yourself. We all can look forward to being 73. That's going to be my kind of next my next great thing, and you know, there are still some things on earth that we don't understand, no matter the best of intentions. So apart from that, I'm not going to try and go through all of the answers, because all you get is my completely plebeian version of it. But I would just like to extend a huge thank you to our speakers who have been so generous in sharing their knowledge with us and giving an insight into this topic. Thank you all so much for your questions and for your participation. I hope you have enjoyed this session as much as I have and found it as interesting and helpful as I have. The event is being recorded, and recording will be sent to everybody afterwards. So you didn't need to make copious notes. Maybe I should have said at the beginning. There is a quick evaluation survey. If you could just take a couple of minutes to fill it out, that would be really, really helpful for the team. Please watch out for alumni e-newsletters and other forms of communication, and for any future webinars which we'll be running this year. And I do know that we have touched on some sensitive subjects. So if anything which has been discussed has affected you, there are lots of resources available, and there should be some links put in the chat. So with that, can I just say thank you, everybody. Have a really, really good afternoon, and hope to see you at another future webinar soon. Thank you.